Good morning. Today we'll have a lecture about candidiasis. In particular, we are going to speak about Candida albicans, about Candida albicans in relation to UGS module. The learning objectives to describe the morphology of Candida albicans, pathogenesis, and especially to see the association between immune system and fungal infection. Candida albicans is a fungus. So we are going to see the association between the immune deficiency and infection with Candida albicans. Secondly, we are going to describe broadly a clinical presentation of Candida infections and the nature of vaginal discharge and to compare it with other type of vaginal discharge that we have spoken in the last 2 or 3 lectures. Laboratory diagnosis and the broad lines about treatment. So we are going to have this lecture, and then after Eid, inshallah, we will continue with another 2 lectures, inshallah. كل عام وأنتم بخير. General characteristics of Candida. Candida are yeast cells, الخمائر, rounded characteristic budding, التبرعم. الخلية هذه اليست يتبرعم منها برعم صغير called budding. And this budding during infection elongate and become a hyphae form. hyphae يعني زي الشريط هيك خيط. As other fungus, Candida has got cell wall composed of chitin and carbohydrates. If you remember your general microbiology, chitin is characteristic of composition of cell walls of fungi or fungi, you can pronounce it. How we identify whether this Candida is Candida albicans or not? Candida albicans is the most important species for a human being infection. There are other 2 species, we are going to mention them at the end of the lecture, which are also sometimes related to human infection. How we identify Candida albicans and say this is Candida albicans? There are varieties of methods: biochemical, enzymatic, morphologic, carbohydrate assimilation, fermentation, hyphae, germ tube formation. Very important. This test is very important. And a chlamydio-conidia formation. I will tell you in a moment what is the chlamydio-conidia. They can be grown on special media like saboroid agar. Saboroid agar is a common fungal media which can be used for cultivation. And also this microbe can grow on a blood agar. You can see it on a blood agar like smooth white colonies, large colonies. If you see it, this type of growth, you may say to me, this is Staphylococcus. Staphylococcus is much smaller than this. The colony size much smaller, about 1 millimeter or less. Here, 2 to 4 millimeter colonies, this indicate Candida albicans. Candida albicans characteristically is germ tube positive. Germ tube, that is to say, the budding will become elongated and and form a tube-like, hyphae-like. hyphae يعني شريط الفنجس. So germ tube positive, and I will speak about it in a moment also. Candida albicans could be present in three forms. Yeast with budding, yeast الخمائر خلية واحدة. Okay, you can see it here. Mother cell خلية واحدة with budding, and this budding is called blastoconidia. So the budding هذا البروز blastoconidia. وكأنما هو الكونيديا، انتم تعرفون الكونيديا is spore like structures of fungi called conidia. Hyphae, the other form, if you grow the candida 37 degrees centigrade at certain pH, it will form hyphae or pseudo hyphae. These hyphae, the budding, as I said, will outgrow and become elongated, tube-like. It is called germ tube. The hyphae, these hyphae or these germ tube, you can see this is the mother cell. Here there will be an outgrow like that when you grow it at 37 degrees centigrade. Another cell, this cell, yeast cell with budding, just budding. This is the daughter cell. The budding, when cut, it will form another cell. But when you grow this budding, it can form what we call it germ tube. The germ tube carry at the terminal end thick-walled chlamydoconidia. So blastoconidia from the yeast form, from the hyphae or germ tube. Sometimes we get elongated form with restrictions, يعني تخثرات. I will show you a picture for it. This is called pseudohyphae. The cell wall include substance which is very important for attachment, manoproteins. And we will go also through details of this manoprotein. You can see here Candida albicans. This is a scanning electron microscope and demonstrate dimorphism. What is dimorphism? It could be present in yeast form and could be present in hyphae form. Yeast form has blastoconidia. Hyphae has got chlamydoconidia. This type of growth, this type of morphology is called dimorphism, as if it has two types of morphology, yeast morphology and hyphae morphology. Both you can see dimorphism and blastoconidia. These are the blastoconidia from the budding cells and macroconidia when they become hyphae, which are blastoconidia, which are another type of conidia, which is very important, called chlamydoconidia. Another picture here at 37 degrees centigrade, these yeast cells will have budding, and the budding will become germ tube or hyphae. You can see here, Candida albicans has been grown on a special media. Special media, I don't want the names from you, like sunflower seed agar, wheat flour agar, cornmeal agar. These are special media for Candida albicans in which the chlamydoconidia will be seen quite clearly in growth on these special media. اسماء الميديا ما مطلوبه منكم، هذه السبيشال ميديا، الصن فلاور والويت فلور and corn meal. هذه فقط there are special media you can say in which you can see well-grown chlamydoconidia. And this can differentiate it from other types of candida. Candida albicans can show these chlamydoconidia. So chlamydoconidia is one of the characteristics of Candida albicans. Germ tube is another characteristic. If I ask you, what is the best test to know whether this is Candida albicans or not, species albicans, you will say to me, germ tube. Plus what? Plus chlamydoconidia. Clinical capsule, candidiasis in general could be localized, could be disseminated. The localized form can be seen as erythema, white plaques, especially in moist area, skin folds. Example for it, diaper rash. What is diaper rash? راش الذي يظهر مع الحفاضات مثلا عند الأطفال, or on mucous membranes, mucous surfaces, which we call it oral thrush. And we will see pictures for these two conditions. Sometimes may cause vulvovaginitis. Female taking broad spectrum antibiotic for a long time, like tetracycline, may have overgrowth of Candida albicans causing vulvovaginitis. So remember, diaper rash, oral thrush, and vulvovaginitis. Deep dissemination of Candida albicans deep in tissue is almost exclusively seen in immunocompromised. Usually, immunocompetent, normal individual, they are not infected with deep dissemination of Candida albicans. This is mainly occurs in immunocompromised. For example, in AIDS, patient taking cytotoxic drugs for cancers, in diabetes sometimes. Diffuse pneumonia and urinary tract infection are common examples of deep invasion of Candida albicans in the body. These diseases, diffuse pneumonia and urinary tract infection, occur mainly in immunocompromised patients. So remember, Candida can cause diaper rash, oral thrush, vulvovaginitis, or deep infection, deep tissue and dissemination like diffuse pneumonia and urinary tract infection. Epidemiology of candidiasis, Candida albicans are present in 30 to 50% at oropharynx or in the gastrointestinal tract or female genital tract. Patients are carrier or persons, individuals are carrier of Candida albicans. How many? 30 to 50%. Where? Oropharyngeal, gastrointestinal, female genital microbiota. So many people, almost half of the population, are carriers of Candida albicans. Therefore, it can be transmitted quite easily from one person to another. Sexual contact or endogenous infection from the same individual can get infection at certain situation. If the immunity is depressed or there is injury to an area, nosocomial infection, another type of infection with Candida. Infection derived from own flora, as I said in the first point. Invasive procedure, like what? Like indwelling catheter, indwelling devices. يعني indwelling يعني باقية في الجسم. واحد يحط كاثيتر urinary tract catheter ويبقى فترة مثلا شهر زمان for 1 month. This can lead to Candida albicans infection. And this catheter may represent port for entry, مكان لدخول الكانديدا, port of entry of the fungus. Lastly, antibiotic use. As I said, when you suppress the growth of bacteria, Candida will have a chance to overgrow. We said 50% are carriers. So these carriers, the endogenous microbiota, will overgrow and can cause infection. Exactly, it occurs like this when a patient, female patient, taking tetracycline for sometimes for a few weeks, she will have super infection, we call it, overgrowth of the Candida albicans, which are present in the genital tract and can cause vulvovaginitis, for example, with itching and vaginal discharge. Pathogenesis, the hyphae form, represent the agent that goes deeply. It starts superficially, but then goes deeply. So hyphae have the characteristic of invasion of the deep tissues of the body. Usually, the yeast form can cause superficial infection. Usually, I am not saying always, but hyphae can invade deep. First of all, there will be strong attachment to epithelial cells via wall protein, hyphal wall protein, HWP1. What is HWP1? Is the hyphal wall protein number one, which is present usually on germ tube, that is to say the hyphae or pseudo hyphae. As we said, there is a substance called the glucomannan. Look at the name. Glucose and mannan, mannose, is also sugar. So glucomannan receptor present on the candida, which is present in yeast form, which attach to epithelial cells via fibronectin. So glucomannan, which is present on the yeast form of candida, attached to fibronectin of epithelial cells. Or there is another way for attachment by hyphal form, which attach to the extracellular matrix of the epithelial cells, which is composed of collagen, laminin, and intactin by hyphal form during invasion. So as if I am saying that hyphal wall protein, HWP1, is responsible for hyphal attachment to extracellular matrix, collagen, laminin, and intactin, while glucomannan is present in the yeast form, responsible to attachment to epithelial cells via the fibronectin. Yeast form, fibronectin. Hyphal form, extracellular matrix via hyphal wall protein. And we will come back to it. Also, candida have other factors. You can see I am saying here, first of all, a hyphal form, a glucomannan. First of all, attachment. After the attachment, Candida albicans has enzymes for invasion, like proteinase, phospholipases. These are enzymes can destroy and digest tissues. For example, aspartic-proteinase, SAP, aspartic-proteinases digest keratin and collagen. This aspartic proteinase, SAP, are tissue specific. These enzymes, there are specific enzymes to invade the gastrointestinal tract or vaginal area and so forth. So it is tissue specific. So you should remember that aspartic or proteinases are tissue specific, and these are produced by hyphae during invasion. Also, Candida albicans, whether it is yeast form or hyphae, can cause what we call or can form biofilm. Biofilm is a surface growth of the microbe. For example, they can form biofilm over the tube of the catheter or the back of the catheter. تعرفوا انتوا الكاثيتر بي تيوب وبي باك لجمع الإدرار مثلا. They can form surface growth on the tube and the back when it is present for some time, for 2 to 3 weeks, for example. They can form biofilm. Remember, Candida albicans can form biofilm. Other microbes can form biofilm. Other bacteria can form biofilm. But Candida albicans also have the same capability. Mechanism of invasion of innate immunity. انتوا تعرفوا الخط الدفاع الاول هو الانيت immunity وبعد الادابتيف immunity. Candida albicans have the capability of masking from toll-like receptor. تعرفوا انتوا الفاجوسيتيك cells وproduce what we call them toll-like receptors. اخذتوها العام الماضي بالimmunology. So Candida albicans can mask themselves from TLRs. Also, they have the ability to degrade, break down C3b. C3b is part of the complement component, which is used for phagocytosis and some other functions. Also, this microorganism can increase the surface protein resembling complement receptors, which are CR2 and CR3. This is very important point. Increase surface proteins similar to complement receptor, CR2 and CR3. it means complement receptor 2, complement receptor 3. This will confuse the phagocytosis. This can be induced by high glucose. For example, hyperglycemia. Remember, the receptor that I have talked about is glucomannan for attachment. So there is confusion between the phagocytic cell receptors and the glucomannan of the Candida. That is why there will be confusion, misleading phagocytosis, which will be inhibited, of course. High fellow growth inside phagocytes leads to death of these cells. Phagocytic cells sometimes cannot kill the Candida inside them, and high fellow growth will be resistant to destruction inside phagocytic cells. That is why this will lead to death of these cells. As we said, when immunity depressed or when a patient taking antibiotics, this will lead to increased susceptibility to Candida albicans. So antibiotic will increase susceptibility, especially broad spectrum antibiotic. Steroid, also another point. Leukopenia, قلة الوايت بي سي, leukopenia, AIDS, chemotherapy, devices like catheter, DM, diabetes mellitus. All these can suppress the immune system and the innate immunity, the first line of protection, and can make the individual susceptible to get infection with Candida albicans. Here we come to this figure, which explain what I have seen. These are the epithelial cells. These are the yeast cells with budding. You can see them. Yeast cells with budding. They attach to epithelial cells via the fibronectin. Fibronectin of the epithelial cells and glucomannan of the Candida albicans. So glucomannan attached to fibronectin on epithelial cells. This is how the yeast form can attach to epithelial cells. Then, if the microbe invades the body, this invasion will be assisted by proteinases or phospholipases. Okay, these will destroy the tissues, and there will be attachment between what I have said to you, hyphal wall protein, HWP1, and the extracellular matrix. Extracellular matrix, you can see here basement membrane, collagen type 4, laminin, intactine. This is how the attachment. The attachment to extracellular matrix, and then the candida will invade deep into the tissues. Here, scanning electron micrograph present. In picture A, you can see the hyphal form and the yeast form are present, and blastoconidia, as we said, with the yeast form, they come with the budding. And also mycelial. Mycelial يعني hyphal form. Below it, الميكولوجي, الhyphal form, mycelium, it's called mycelium, يعني خيط. Although it is not real hyphae, they are usually pseudo hyphae. After invasion and destruction, they produce these holes, these cavities on the cell membrane of the infected cells. You can see that the candida here has budding, and they create these destruction in the cell. That is why these cells are going to be destroyed. Immunity, humoral and cell-mediated immunity. Of course, we said innate immunity. Neutrophils are part of the innate immunity, first line of defense. But when breached, when the candida goes deeper, humoral and cell-mediated immunity start to work. Candida can be phagocytosed in opsonization process. You know, opsonization can occur via antibodies and complement. They catch the microbe through or by the assistance of antibodies or complement. That is why I said C3b and complement receptors. Anti-Menin IgG activates the complement. Antibodies, which are produced against the Menin of the Candida albicans, or glucomenin, you can say, of IgG type, can activate the complement. Antigen antibody, then complement will be activated. The candida is the antigen. The antibody, when present, complement will be activated. Mucocutaneous candidiasis is associated usually with T-cell immune deficiency. Mucocutaneous candidiasis. Oral and vaginal candidiasis are common in AIDS. The cell wall menin can down regulate the cell-mediated immunity, suppress cell-mediated immunity, the menin part of the Candida albicans. You know, we have cytokines. The T cells have got Th1 and Th2. Th1 cytokines, I am sure that you know Th1 and Th2 from your immunology. Th1 cytokines, which are interleukin 2, interleukin 12, interferon gamma, tumor necrosis factor alpha, increase in the production of these cytokines will increase resistance of the body and increase in the production of cytokines of Th2 type 2, that is to say interleukin 4, interleukin 6, and interleukin 10 can be associated with a chronic disease. That is to say, If there is an increase in these cytokines, usually present with the chronic diseases, as if there is suppression of Th1 in order for Th2 to produce these cytokines. There is equilibrium between Th1 and Th2. إذا الشخص عنده Th1 تزيد الريزيستنت تبعه. إذا عنده Th2 أكثر يصبح عنده chronic disease. Clinical aspects of candidiasis. There can be superficial mucous membrane, mucous membrane. You see white, cheesy plaque, painless, which is called oral thrush, on the tongue, on the palate, maybe single, maybe multiple. And you can see this is the thrush. This is the vulvovaginal candidiasis. This is the chronic mucocutaneous candidiasis, which I have just said. This is the diaper rash مع الحفاضات عند الأطفال. Vaginal candidiasis, thick curd-like discharge and itching. Curd يعني متخثر. And I want you to compare this type of vaginal discharge with the discharge that we have spoken about it when we have spoken about a trichomonas vaginalis, trichomoniasis. We said thin, yellowish. We said thin, yellowish discharge and frothy, thin, yellowish, and frothy discharge of a trichomonas. And we said also another, in case of bacterial vaginosis, we said the discharge is fishy odor. Now the discharge with Candida albicans, thick curd-like discharge, يعني متخثر, and itching, associated with itching. Also, this can occur in a sort of chronic and recurrent infection, the vaginal candidiasis. Skin infection, usually in a crural area, مكان الفولز, يعني تحت الأبط مثلا, at the inguinal region. If there is an area wet and macerated, أحيانا ما بين الأصابع في الرجلين في المي. Okay, this can lead to candida infection. Best example is the diaper rash. Diaper rash is the rash which is present in children due to wet and covered environment, for example, which appears with diaper الحفاضات يعني. Recurrent immersion in water, dishwashers, دول العمال اللي يشتغلوا في المطاعم لفترة طويلة أو يشتغلوا في الحمامات العمومية، يصير عندهم infection في القدم أو في اليد إلى آخره نتيجة wet areas. And the area will become erythematous, tender areas with fissures. Chronic mucocutaneous candidiasis, when there is defect in Th1, which lead to an increase in the activity of Th2, which result in a chronic mucocutaneous candidiasis. Anergy, that is to say, no response to candida antigen sometimes may occur in case of immune suppression, in case of diseases like sarcoidosis. Candida may invade to deeper tissues, may invade to esophagus in AIDS. One of the AIDS defining illnesses is infection of the esophagus, Candida esophagitis, in which the patient will suffer from painful swallowing. Remember this, painful swallowing, substernal chest pain, excessive ulceration of the esophagus, which may lead to perforation of the esophagus if it is so severe. Sometimes it goes down and involves the stomach and intestine. We said the GI tract involved in the Candida invasion. The urinary tract also. The urinary tract could get Candida albicans infection through the blood, hematogenous spread, or ascending from the urinary tract itself. You start with cystitis and then pyelonephritis. Abscesses could be also seen in these areas, especially in old people, because these are susceptible to Candida invasion. Also in hospitalized patients, in immunocompromised individuals. Another infection is infection of the eye, endophthalmitis. It can reach to the retina. It can reach to the vitreous humor, السائل الزجاجي بالعين. This is the thrush. This is a patient with AIDS, the white plaques which are present on the tongue. Characteristic of Candida albicans infection. If it goes deeper, it will go to the esophagus. This is another picture of diaper rash in a child in diaper area, مكان الحفاضات. And you can see here gram stain. This gram stain shows the yeast cells, these yeast cells with budding, and also can show the pseudohyphae, the germ tube with restrictions, تخثرات. This is called pseudohyphae. So pseudohyphae and yeast cells. This is Candida intertrigo. حكينا هون لو تذكروا بالمكانات الفولتس. Right? If you have areas of faults, skin infection, crural areas, wet areas can suffer from Candida infection. Example of it is Candida intertrigo. هاي تحت الأبط. واحد دائما يتعرق منطقة رطبة, especially in obese people. If you have a woman, obese people, obese woman with diabetes mellitus, area is wet. Under the breast, in obese female also, you can get Candida intertrigo. Remember the name, intertrigo. Diagnosis, we can have superficial infection, we can have deep organ infection. The extracellular, we can take exudate or epithelial scraping. We do KOH preparation, you know the KOH, or we can do gram stain, and you see the budding cells. We said in superficial infection, you see the yeast cells with budding. Now, if with hyphae formation, it means it is Candida albicans, germ tube test or pseudohyphae. When you grow the Candida in certain enriched media, like serum, for example, or plasma, right? At 37 degrees centigrade, they will form germ tube or pseudohyphae. This is characteristic for Candida albicans. Culture can be done for these types of infections on a blood agar or on saboroid agar. Samples, for example, you can test the blood for Candida. You can test sputum. But remember, if you test sputum, that 30 to 50% of individuals are normal carriers. So remember, it is part of the contaminated flora. يعني انت مو اول من تشوف كانديدا تحكي انه هذا المريض عنده candida infection. Remember that half of the populations are carriers of candida at their oropharyngeal area. Also, we can aspirate from areas. We take biopsy, bronchoalveolar lavage to see whether there is pulmonary infection or not. Deep infection, also direct aspiration. You can aspirate a sample from an area of infection. Also, you can take biopsy to see whether candida is present or not. Treatment, varieties of drugs can be used. Amphotericin B, nystatin, flucytosine, caspofungin, azoles, these are all antifungal. How we select them? Superficial infection, we can use topical nystatin or azoles. هذا الازول حكينا عليه. Example of azole, clotrimazole, miconazole. We mentioned these when we have talked about antibiotics. Also, you have to decrease the moisture and the trauma to the area, because we said Candida albicans can grow at area of moisture. Control predisposing factor, like what? Like diabetes mellitus, DM, diabetes mellitus. Or if the patient has got catheter, you can remove the catheter and put another new catheter or replace it by another way of collection. Persistent or relapsing or disseminated deep infection, fluconazole, amphotericin B, caspofungin. Fluconazole, effective for mucocutaneous candidiasis, very effective drug, fluconazole, which is used. Lastly, other types of candida. Most of the time about Candida albicans. There are other species, Candida tropicalis and Candida glabrata. Candida tropicalis comes usually with indwelling catheter. مريض عنده catheter لفترة. It can be Candida tropicalis, can be Candida albicans also, but Candida tropicalis comes usually with indwelling catheter. Candida glabrata has no hyphae characteristic, only yeast form. It is microbiota. Candida glabrata. ولهذا السبب واحد مو من يشوف كانديدا يحكي أنه هذه Candida albicans. These are part of the normal microbiota in the genital and GI tract. And Candida glabrata may cause UTI and fungemia or fungemia, that is to say, presence of the fungus in the blood. Treatment of these two species similar to Candida albicans, but Candida glabrata is more resistant to fluconazole. I stop here, and if you have any question or comment, please do. Any question?
دكتور، يعني هسه الكانديدا باليست فورم لما نشوفها تحت الميكروسكوب بتكون ما فيها مشكلة، بس إذا شفنا هاي في معناته بيكون في انفكشن، صح؟
يعني it is right like that. If you take superficial infection, usually you are going to see the yeast form. Deeper infection, if it goes deeper, it is going to cause or to show hyphal form. Also, the hyphal form or the germ tube is part of the laboratory investigation. You can put a plasma with the candida and incubate at 37 for 1 hour. If it is Candida albicans, is going to form germ tube. Germ tube, you take a drop from this plasma in incubation, and then you put it on a slide and examine it under the microscope to see whether there is germ tube or not. جيرم تيوب هو الفحص المعتمد في المختبرات حتى نعرفها كانديدا البيكانس ولا لا.
شكرا دكتور.
عفوا يعني. Other question?
الكانديدا يعني عندها نوعين من الهاي، اللي عندها النوعين تبعون الهايفي والسايدو هايفي، سيدو هايفي. ولا بس واحد منهم؟
الكانديدا عندها two forms. Candida albicans, it has two forms. One form is the yeast form, which can be present as normal flora, sometimes can cause superficial infection. If it's going to cause deeper infections, it will have a predominantly hyphal form, which have the capability of producing destructive enzyme like proteases. واضح؟
واضحة دكتور.
نعم. Other question? If no questions, I stop here. ونراكم إن شاء الله بعد العيد وكل عام وأنتم بخير. السلام عليكم.